You know what's happening in America right now? A country that sends rockets to Mars. A country that builds trillion-dollar tech companies. A country that calls itself the most advanced nation on Earth. That same country is forcing ordinary people to open GoFundMe pages just to stay alive. And this is not a past problem. This is happening right now as you watch this video. Every minute, someone goes bankrupt because of a hospital bill. Someone skips treatment because they can't afford it. Someone is hesitating to call an ambulance because it might cost $5,000 to $10,000. In the richest country on Earth, people are scared of hospitals more than they are scared of diseases. Just think about how shocking that is. Right now, a father is looking at his sick child and wondering if he should take her to the ER or pay next month's rent. Right now, a diabetic student is rationing insulin because in America, it costs 10 times more than anywhere else. Right now, a cancer patient is being told their treatment is not medically necessary by an insurance company that made billions in profit last year. This is not healthcare. This is a business model. A business model where humans suffering revenue. America has the best doctors, the best research, the best medical technology in the world, but the worst healthcare system. A system so broken, so expensive, so predatory, that millions of Americans live in constant fear, not of getting sick, but of the bill that comes after it. In this video, we are going to break down how the world's most powerful country created a healthcare system that doesn't save lives, it sells them. Stay till the end, because once you understand how this nightmare works, you will never see America the same way again. Let's start with something simple. How much does it cost to go to the hospital in America? Break your arm? Around $2,500 to $5,000. Need an ambulance? That'll be $1,200 to $3,500, depending on your zip code. Got cancer? You're looking at $150,000 to $300,000 easily. And that's with insurance. Without it, good luck. You might as well sell your house. Here's the part most Americans don't even realize. These prices aren't fixed. They're not even logical. Hospitals charge whatever they want literally. There's no national price list. So, two hospitals in the same city could charge 5 times different prices for the same MRI. And it's legal. It's not a healthcare system. It's a wild, chaotic market, and you're the product. Act 2. The Great American Myth. Now, Americans love to say, we have the best healthcare in the world. And yeah, we have the best doctors, the best technology, and the most expensive machines. But none of that matters if you can't afford to use it. If you're rich, America probably does have the best healthcare in the world. But if you're middle class or poor, it's a nightmare wrapped in paperwork. We rank 37th in the world for healthcare performance, according to the World Health Organization. That's below countries like Spain, Japan, even Costa Rica. And yet, we spend twice as much per person as most developed nations. So the question is, where's all that money going? Act 3. Follow the money. Let's break it down. Every time you see a hospital bill, there are 3 major players taking a cut before your doctor even gets paid. 1. Insurance companies, the middlemen who decide what's covered and what's not. 2. Pharmaceutical companies who set drug prices however they like. 3. Hospitals and private equity. Yes, Wall Street owns hospitals now. Insurance companies don't exist to provide healthcare. They exist to deny it. That's literally how they make profit. The less they pay for your care, the more money they make for shareholders. Pharma companies, they say high prices are for innovation. But most new drugs are actually funded by taxpayer money through the National Institutes of Health. Then the pharma giants buy the patents and sell the drugs back to us at 10x the price. It's genius, evil genius. And hospitals, many of them are non-profit, which sounds good, until you realize that just means they don't pay taxes. Their CEOs still make millions. They build luxury wings for donors. And they charge you $50 for an aspirin. Act 4. A system built by accident or designed. Let's rewind to understand how this monster was built. Because this didn't happen overnight, it's the result of decades of bad policy, greed, and corporate lobbying. It all started during World War II. Back then, the US government froze wages to control inflation. So companies started offering health insurance as a perk to attract workers. That's how we got employer-based insurance by accident. After the war, the government doubled down. Instead of creating a public system like Europe, America let private companies take over. And by the 1950s, health insurance became tied to your job forever. It sounded great at first. But what happens if you lose your job, or switch jobs, or your company shuts down? You lose your insurance, meaning you lose your access to healthcare. It's like saying your right to live depends on your employer. It's insane, but it's the American way. Act 5. The corporate takeover. By the 1970s, the real predators entered the scene: for-profit corporations. One of the key moments came in 1973 when President Nixon signed the HMO Act. That law allowed private, profit-driven health maintenance organizations to expand nationwide. And one of Nixon's advisors literally said, and I quote, "The less care they give, the more money they make." That was the business model. From that moment, healthcare officially became a corporate product. Insurance companies started treating patients like data points. They used algorithms to deny claims. They created networks that trap you into specific hospitals. And pharma companies, they realized they could raise prices every year with no consequences. That's when it all changed, from healing people to healing balance sheets. Part 2. The moment the bill starts. The moment a doctor says, "You have cancer," two systems activate at once. One is medical, the other is financial. Before you understand the stage of the disease, before survival statistics are explained, before shock even settles in, the billing process has already begun. Scans are ordered. Blood work is scheduled. Specialists are consulted. Biopsies are performed. Each step is coded. Each code has a price. Each price is hidden until after the fact. You are never shown a menu. You are never warned what comes next. You are never given time to think, because fear removes negotiation. When someone is sick, they don't compare prices. They don't shop around. They comply. This is not a flaw in the system. It is a system. As Part 1 established, American healthcare does not operate like a public service. It operates like a market designed to extract money at the moment people are most vulnerable. In that market, cancer patients are not treated as human beings first. They are treated as high-value customers. In America, cancer is not just a diagnosis. It is a financial trigger that activates an entire industry built around fear, urgency, and silence. Part 3. Insurance, the illusion of safety. Most Americans are raised to believe one simple rule: if you have insurance, you're protected. That belief collapses the first time real treatment begins. Insurance is not protection. It is a gatekeeping system. Its core function is not to help you heal. It is to decide how much care it can avoid paying for. Once treatment starts, the language changes. Prior authorization required. Out-of-network provider. Experimental treatment. Not medically necessary. Your doctor recommends care. Insurance questions it. Your doctor says delays increase risk. Insurance says paperwork comes first. Every delay saves money. Every denial increases profit. And here's the reality most people never expect. The majority of medical bankruptcies in America happen to people who were insured. Insurance does not remove risk. It relocates it away from corporations onto the sick. When the system finally fails you, it still sends the bill. Part 4. The first financial shock. Then comes the first real bill. Not the final one. Not even the largest. Just the first. A number so high it doesn't register. $19,000. $28,000. $45,000. You assume it must be a mistake. You call the hospital. They tell you to call insurance. You call insurance. They tell you to call the hospital. You are trapped between $2 billion institutions, neither accepting responsibility, both demanding payment. This is the moment fear changes form. At first, you were afraid of dying. Now, you're afraid of surviving. You begin calculating time and payments instead of years. You delay appointments. You ask questions no patient should ever ask. How much longer can I afford to live? This is the moment survival becomes conditional. Part 5. When care becomes a business. Part 1 explained how this system was born. Now look at what it evolved into. By the 1970s, healthcare stopped pretending to be nonprofit in spirit. For-profit insurers expanded rapidly. Hospitals merged into corporate chains. Wall Street entered medicine openly. The 1973 HMO Act did not create the problem. It legalized the business model. One of President Nixon's advisors said the quiet part out loud. The less care they give, the more money they make. That sentence became policy logic. Doctors became cost centers. Patients became risk profiles. Hospitals became revenue engines. Healthcare didn't slowly drift away from healing. It was aggressively pushed toward profit. From that point on, medicine stopped asking what patients needed. It started asking what treatments maximize margins. Part 6. Price tags with no logic. In a normal market, prices reflect value. In American healthcare, prices reflect leverage. Hospitals rely on something called a charge master, a massive internal price list with no connection to reality. An aspirin, $50, a saline IV, $200, a routine scan, thousands of dollars, 2 hospitals. Same city, same equipment, same procedure, completely different prices, and it's legal. Because transparency would destroy this model. Confusion protects it. Patients don't compare prices in emergencies, they absorb them. By the time the bill arrives, the transaction is already complete and irreversible. Part 7. The debt that never leaves. When treatment ends, the bills don't. They don't slow down. They don't forgive. They don't disappear. They follow patients home, long after the hospital visits stop. They arrive as envelopes, emails, phone calls, reminders that survival has a price tag. Medical debt destroys credit scores. It blocks mortgages. It delays marriages. It forces people to stay in jobs they hate just to keep paying. Hospitals sue patients who already lost years of their lives. Collection agencies harass survivors who did nothing wrong except get sick. Wages are garnished. Savings vanish. Beating cancer is supposed to be the end of the nightmare. In this system, it's just a transition. You beat the disease, but the system still owns a piece of your future. Part 8. Why prevention doesn't matter. You start wondering how this could have been stopped. Earlier tests, better warnings, real prevention. But you slowly realize something uncomfortable. The system never pushed that. No one chased you down for early screening. No one made prevention urgent. Because if you never get sick, you never enter the machine. Healthy people don't generate invoices. They don't refill prescriptions. They don't come back every month. You do. So, the system doesn't revolve around stopping disease. It revolves around managing it indefinitely. You're not treated as someone to be cured. You're treated as someone to be maintained. This isn't about negligence. It's about incentives. Prevention would end the story early. And this system doesn't make money from endings. It makes money by keeping you just sick enough to stay inside. Part 9. How the rest of the world does it. Then you hear stories from elsewhere, and they sound unreal. People get diagnosed and focus on healing, not invoices, not credit scores, not whether treatment will bankrupt their family. In other countries, no one asks how you'll pay before they treat you. Hospitals don't hide prices behind legal language. Doctors don't pause to check profit codes. You don't come out cured but financially ruined. You come out exhausted but intact. That's when it hits you. This isn't about medicine being impossible. It's about choices. Those systems chose people first. This one chose revenue first. You weren't unlucky. You were processed by a system that values extraction over recovery. And suddenly, your suffering feels unnecessary, not inevitable. Part 10. The emergency room trap. Now imagine you didn't even get time to think. An accident. A collapse. An ambulance. You don't choose the hospital. You don't choose the doctor. You don't choose the price. You're unconscious, terrified, or in pain. They save your life. Weeks later, the bills arrive. Some doctors weren't in network. Insurance refuses parts of the claim. Appeals go nowhere. You never agreed to any of this. But you still owe thousands. You did everything right. You survived. And the punishment comes afterward. Emergencies strip away the illusion of control. They expose the truth. In this system, survival doesn't protect you. It invoices you. Part 11. The final reality. Here's what no one says out loud. In America, survival is conditional. On your job, your insurance, your savings, your timing. You can do everything right and still lose everything. A six-figure medical bill isn't rare. It's normal. You don't just fight disease, you fight paperwork, fear, debt. Getting sick shouldn't rewrite your entire future, but this system turns vulnerability into profit. This isn't about bad doctors. It's about design. Systems do exactly what they're built to do. And until healthcare stops being a business, until people come before margins, this story will repeat. Different patient, same system, same outcome.